Hi, and welcome to this week's live. I am Sheila Craig Whiteman, Dr. Sheila, the pelvic coach, and I would like to welcome you to today's topic. So, we are going to talk about what is urinary incontinence, or just how do I know that I have it? Like, what is going on with me and the leakage? So I'm going to start out first by telling you an interesting story that I think it's amusing. But I treated hundreds of women for urinary incontinence, and when I was treating them face to face in the clinic, I had a lot of denial and pushback from my patients saying, I don't really have urinary incontinence, especially when they came in for another issue. So you can come into pelvic health clinic for pain with intercourse, pelvic pain in general. There are just a multitude of things that we treat and help women with. But they would come in wearing a pad, okay, so wearing either a menstrual pad or wearing even a small incontinence pad. And I would say, well, why do you have this pad on? Oh, I just have it on just because, sometimes I just feel more secure with it. Well, do you ever leak or whatever? No, I don't leak. However, if I cough or sneeze, sometimes a few drops come out. Well, that is urinary incontinence. So whenever you have a leak that an amount of urine that escapes, that you don't know that it's happening or that you can't control it, that is the true definition of urinary incontinence, better known as bladder leaks, because we do call it bladder leaks. Most people do. So that being said, how do you know that you have a bladder leak? Well, okay, so answer the question right there. If you have any uncontrollable leakage, so if you leak even a couple of drops and you didn't mean for that to happen, then that is considered urinary incontinence. So that puts a lot of people, right? A lot of people in that category. So if you look at research, it's about 33% of women who say that they have this issue. But if you think about what I just said and the denial factor, well, we know that it's actually more than that. So it's a really, really common problem. If you have bladder leaks, urinary incontinence, you are not alone. You have plenty, plenty, plenty of company. So what are the other things, or what are the other kind of problems that might happen where you say, oh, well, let me maybe think about I should get some help because this could be bladder leak and could be serious later on. And just to back up on that, bladder leaks never start out, or very rarely, because you never use absolutes, but they rarely start out where one day you just sweating through your clothes. You usually have some kind of a idea or some kind of a warning before that this is going to happen. And that would be the few drops that you have when you cough, leak, or sneeze, or even exercise, right? So it's on exertion. The going to the bathroom, having to run to the bathroom when you get to your door, pulling down your pants and a couple of drops come out. That's considered urinary incontinence. Also, if you have issues at night where you don't really get enough rest, you can't rest because you feel like you have to go to the bathroom every couple hours. So you're getting up to go to the bathroom so you don't leak. So in that case, you don't necessarily leak, but you're still running to the bathroom. So we still put that, it's not considered bladder leaks, but we put that in a category where it still should be treated and there still should be intervention. So there are different types of urinary incontinence. I'll just mention them quickly because I like to jump on here, give you some information, and then come back out. I want you to get a little bit of information. We'll just do little chunks at a time. But there's stress urinary incontinence, where that's that cough, sneeze, your bladder, your muscles are under stress. So they have to hurry up and react, to like really hurry up quick. And they just can't do it fast enough. That's stress urinary incontinence. Urge urinary incontinence, where you have this urge, you just have a strong urge to go. Like, why? So I have this strong urge to go. That one of the keys to that is the going to the bathroom example I just did, or putting your key into the door. The last one I'll mention today, I'll come back and mention some more next time, is nocturia. So nocturia is kind of like a sound. So that's at nighttime. So remember, I just said nighttime, you could have leakage, you could not have leakage, but you don't get any sleep because you're getting up to go to the bathroom more than twice. We're only sleeping for 8 hours. So if you're getting up 4 times a night, you're not getting any rest. And as we well know through all kind of documentation, sleep is extremely important for our well-being. So if you like the tip for today, please comment in the bottom. If you have something, a burning question that you want to ask, you can put that in there too. Remember, if you want to get notifications on when a new tip, when I'm talking again, just hit subscribe. You'll get the notifications. If you don't want the notifications, just still subscribe and just put no notifications. So please subscribe to my channel and share. And until next time, I thank you for listening. And hopefully you've got some information that will help you. Until next time, bye-bye.